The following programme contains scenes of nudity and surgical procedures of an extremely graphic nature from the beginning. Viewer discretion is strongly advised.
Welcome back to the final part of the Cosmetic Surgery Show. Would never consider performing. I'll throw that to you first, Dr. Ray.
You know, I feel a little bit uncomfortable with gender dysphoria issues, and just as a personal thing, but it's certainly very commonly done in Los Angeles.
What about in Ireland? Is that a common procedure?
To an extent, we get the other end of it, and that is patients who have maybe been psychologically assessed, you know, sort of for transgender issues, and they would come to us for instance, to get rid of their hair. If a male wants to change to a female and they're already on the estrogen tablets, they would have breast implants. And so our laser hair clinic certainly would deal with at least one patient a month.
I'm not here to criticize, I just feel uncomfortable reassigning gender. And that the entire spectrum, from breast augmentation to actually changing the sexual organs. Just a personal thing, but I'm not here to criticize or cast judgment. Just I feel uncomfortable with it.
I'd like to take it back to the more aesthetic cosmetic procedures. I see every day living in Los Angeles people who have very clearly gone too far. And I wanted to ask, this is more your opinion rather than your professional view. Do you think these people think they look good with stretched faces and inflated mouths? Is that the look they're going for? Do they walk in and say, I want that?
I think to be good at aesthetic surgery or medicine, and probably Dr. Ray will agree with this, I think you have to have an eye for beauty to start with. And some of the procedures that I've seen performed have been, in my eyes, so horrific, they just go against the normal aesthetics of nature. They present in a clinic in the UK and Ireland, I'm sure in the United States as well, suffer from BDD, which is body dysmorphic disorder. And you really have to be careful of the person who comes in, who knows you by a first name, who often talks down other doctors, who doesn't tell you procedures that they've had before, who gives you the wrong address, who sees something there that nobody else can see.
There are a lot of outlandish treatments, procedures that are available in the US, in Brazil. We seem to copy everything America does. Is that where we're headed, Ailish?
I suppose down the road, you know, I suppose sadly, yes.
Are we headed towards homogenised faces, all looking the same teeth, the same boobs?
Well, I mean, the teeth definitely. I mean, we know the teeth has definitely come in, very, very much so.
Mind you, we needed them badly also.
We did need the teeth, in fairness.
The mirror is not reality. When we look at the mirror is a two-dimensional object. But the mirror will lie to you. It will make you look, you think you look beautiful. But you have that windblown look, the overpulled, the round eyes. And so a little bit of plastic surgery is good, I think, because we really, in fact, at the end of the day, we are into building people's self-confidence. That's what we do.
Finally, Dr. Ray, my mother is in her 50s, has the lines and wrinkles of time. I think she looks beautiful, as she is. What is your answer to the aging process? Are you totally anti people looking their age? Do you think youth is the way forward?
You know, I think aging is a normal part of our mortal journey, but we expedite that aging. The experiment I always tell people is, drop your pants and look at your tushy. Your tushy is far younger than your face. Why? It's not subjected to the sun abuses. It's not subject to the pollutants, the stress. So if we had followed what we're supposed to do with our bodies, if we're taking care of our bodies, i.e. no coffee, no smoking, control the stress, and so on and so forth.
So if we sat in the yoga position eating green beans.
We would not have aged to the same point.
And you wouldn't know that Dr. Ray was 64 years of age.
You would.
You see the beauty of taking care of yourself? All done naturally.
I'm going to have to stop you there. I'm going to have to stop you there. Unfortunately, we've run out of time. Thank you so much for joining me.
You're welcome.
Coming up in the final part of the Cosmetic Surgery Show, we're joined by Ellen as she shows off the results of her surgery. And it's back to Texas for more of the liposuction procedure.